Greetings, thanks for coming back to check out these series on irritable bowel syndrome. We're going to talk about the signs and symptoms of IBS or irritable bowel syndrome. So the most common sign I would see in a patient, or what the patient presents with the symptom, will be abdominal pain or cramping. Now that can occur anywhere in the lower abdominal region. Don't get confused with the pain of diverticulitis and irritable bowel syndrome. Diverticulitis, in my opinion, occurs a little bit more on the left side here. So if the bowel runs across like this and comes down and goes out like that, we're looking at an area, a spot around here. Okay. So if you've got a pain in one particular part of the gut, and it's just a very low-grade, dull kind of a pain, particularly if you're in your 50s or 60s like me, it can also be diverticulitis kind of pain. This pain can come and go. This pain is particularly prevalent in people who tend to hurry up with their bowel motions. They force their bowel motions. They could have a little bit of stress, sympathetic dominance, a bit of a dry bowel, not consuming enough water. Especially common to find diverticulitis in people who drink a lot of coffee. Or a lot of alcohol, people who have a dehydrated bowel. I find it very common in thyroid patients who tend to be very quick and irritated kind of people. The pain with IBS is a different kind of pain. It's accompanied often by irregular stools, constipation, diarrhea, cramping in the gut, recurring. And if you've had it for more than 3 months on a very regular basis, it's considered to be IBS. It's important, if you've got any of these signs and symptoms, that you talk to a healthcare professional about it. Particularly if you've got things like rectal bleeding or bad hemorrhoids, a lot of mucus in the stool, if you've got weight loss associated with it, or if the pain wakes you up at night, then you need to see a GP urgently, or talk to somebody like me about it so you can get properly assessed. I believe I'm a responsible naturopath because I work very much with gastroenterologists and medical doctors. I really believe that it's important to get the bowel assessed professionally, especially if a stool test is going to pick up high levels of inflammation and there's a bit of occult blood, or we find bleeding, you've got a low iron count, you've got weight loss, there's weakness, you definitely need checking out. Okay, prevention is definitely a smart idea when it comes to digestive problems. So remember, in a previous video we said there are 3 kinds of irritable bowel syndrome: IBS-D, irritable bowel syndrome, diarrhea; IBS-C, irritable bowel syndrome, constipation; or mixed, where you can have them both. So it's not uncommon to see mixed patients in the clinic who for a few days will have a normal functioning bowel, and then for 1 or 2 days it'll be quite loose. Or they could pass out like sheep pellets, little round bits of rabbit poo, and then they may skip a day. I'll never forget when a patient came to see me a long time ago, it may have been like 20 years ago, and I asked her how often she was passing a motion. And she said, about once every 14 days. I said, well, what did your GP say about that? Well, he said it was quite okay. If that's my pattern, that's normal, to have a bowel motion every 2 weeks, and that was okay for me. And my immediate reply was, well, how often do you put your garbage can out? Once every 3 months. Oh, heck no, every week. I said, well, imagine all the crap built up in your gut. What happens to it all? How much are you eating? Where's it all going? And that made her quite horrified. So that patient went straight off to a colon therapist. Sometimes these patients, now I hope you're not watching this video as you're eating your breakfast. If so, turn it off, all right? So sometimes these kind of patients will pass out a stool that's 2 foot long. Literally 24 inches of bowel motion will come out when they get a colonic, when we clean them out. So it's incredible how many people are constipated. It really is, particularly with my American clients. I would say about 50% of people I see in my online clinic through Skype have actually got quite major constipation. They'll have a motion every 2 or 3 days, and that's not unusual for a lot of people. So that tells me a few things. They're not walking enough. They're not drinking enough. There's too much coffee, tea, and alcohol. They've got the wrong food choices, and there's a high element of stress there as well. So those are quite apparent when we talk about these kind of issues with that client. So let's go back to signs and symptoms. constipation, diarrhea, gas, bloating, cramping. Some people have spasms or shooting or darting pains up the rectum or in the gut. Pattern that will go on for 3 months. Sometimes these problems can go on for years. So get it assessed, get it checked out. If in doubt, get a comprehensive stool test done. All right. Stay tuned. We've got a few more videos coming up yet on IBS. Tests and diagnosis for IBS. That's my next video. If you haven't got my free Candida report, please click on the link down below. See you in the next video.